Bell. Thank you.
Good afternoon, and thank you for tuning in to today's media briefing. We apologize for the technical issues experienced with the phone lines yesterday. However, we are back today to pick up from where we left off. Joining us are the Honorable John Hagee, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Before we resume the question and answer session, Minister Hagee, do you have any comments you'd like to make?
Not really. Thank you, Kathy. I apologise for whatever it was that went wrong with Mr. Bell's technology yesterday, but I'll hand it back to you so we can resume the questions wherever they were left off. Thank you.
Perfect. Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hi.
Hello.
Peter.
I'm going to blame QAnon for yesterday. I was going to ask about the Alberta situation. There are a lot of cases. There seems to be one almost every other day trickling in from Alberta, and I think some people are concerned if there's some specific hotspot there that they're coming from. are these just random cases? Can you explain what's going on there, and if there was some threshold at which you'd declare stricter measures?
So with regard to the cases coming from Alberta, I think, first of all, we have to remember that a lot of our traffic comes from Alberta, and that there are a lot of people, when it comes to traveling, that's where most, well, I can't say most, but certainly a lot of our travel is coming from Ontario and Alberta. So that's the first thing. So, if we're going to see cases, we are going to see them more likely from the places where we have the most travelers. Some of those cases, not all, but some, were all related to the same outbreak within a workplace. So that certainly reduces the risk. So they're not all coming from different places. So as of right now, there certainly does not appear to be any concern about increased risk from Alberta. Of course, we're concerned about risk from everywhere across the country right now, but not with Alberta in particular.
Okay. And I wanted to ask something else that's come up a lot from people who contact us. That is the confusion about the length of time someone has to isolate when they come home. It's normally 14 days or 7 for rotational workers if they get a negative test. But if someone actually has COVID and they're tested for it here, they can theoretically be released after 10 days from those initial symptoms. Is that correct?
Yes. So if somebody is diagnosed with COVID, so they have a positive test, the criteria that's used nationally for recovery, we'll say, for the recovery from the virus, is a resolution of symptoms as long as it's 10 days post symptom onset. So 10 days from the time of symptom onset, provided their symptoms are resolved. So if symptoms are ongoing, they wouldn't be considered recovered, right?
Yeah, it's not really a follow-up, but if I could just clarify. So that means theoretically someone could be 10 days free if they had COVID, as opposed to 14 days if they're only isolated.
Yes, but I mean, if somebody tested positive very soon, like if they became symptomatic very soon after arrival, and then we, it would have to be in the first couple of days. Most people are not doing that. We're seeing most people are 4 to 5 days after they get home before they start to develop symptoms. So not sure that we've run across that situation very, very often, if at all. In theory. But then, the risk, if they've already got COVID, they've already got COVID. The quarantine period the incubation is already passed. The whole point of the quarantine period is to wait out the possible incubation period of the virus, right? So if you've tested positive for it, then that's done.
Okay, thank you.
Our next questions are from Richard Duggan of VOCM News. Please go ahead.
Thank you. We had a call to the VOCM newsroom yesterday from a man who says he's a rotational worker, and he was on a flight recently that went from Toronto to Halifax, and then from another flight from Halifax to this province. Recently, he found out through social media that someone on that Toronto to Halifax flight tested positive for COVID, and that he was within the rows on that plane that were being advised to get tested. Now, he wasn't notified of that. He found out about it through social media. So I was just wondering, when we have a situation like this where there's multiple jurisdictions involved, what's the process for notifications here?
So depending on where the case was, so that the jurisdiction that does the investigation for the case would then notify notify the jurisdictions of any close contacts. So if Newfoundland and Labrador were identified as having close contact, then they would be notified. And then Newfoundland and Labrador would follow up with those contacts. In the situation of a plane, there are mechanisms in place. So the jurisdiction in question would send notification to the Public Health Agency of Canada that then posts it on a website. And people can check that website to to see if if there's been any reports or exposures on flights that they've been on.
So just to clarify on that point, so the onus would be on the person who was traveling to be checking those notifications on the Health Canada website?
Yeah. So certainly the recommendation would be for people to check that website to see. And if a jurisdiction felt that there was a risk, then a significant risk, then they would notify the jurisdiction with any close contacts.
Richard, I think it's worth just saying at this stage that we are the only jurisdiction until very recently that actually published flight information for arrivals into Newfoundland and Labrador. Obviously, it's easier when those flights are direct, but we have in the past included those that have come via Halifax when we know we have a case. The Public Health Agency of Canada is the repository for what other jurisdictions do, and obviously we don't have any control over that. And the other piece is that in terms of the manifests off the flights, we don't actually have access to those for apparently privacy reasons from the airline carriers. And that's why we, through Dr. Fitzgerald's advice, have chosen to rely on the system that we have at the moment. As you can see, if there are legs that involve travellers getting off in other jurisdictions, we don't really have an awful lot of insight into that through the mechanisms at the moment, save for the safety net, as it were, of Public Health Agency of Canada calling people they can identify who might have been at risk.
Okay, thank you. And my second question is, with that threat of the possible second wave continuing to loom, how prepared are our healthcare facilities to deal with a possible influx of patients due to that second wave?
That's a very good question. I think we've had significant things we've learned since the first wave and our clusters there. What we do know is that it takes less than a week to half empty the capacity we can achieve. And we have done very well. In actual fact, I think we lead the country really in our ability to contact trace and contain identified cases. So we have some things up front and we have some things behind. What we're worried about from a public health point of view, quite frankly, is the coincidence of a flu wave and a COVID spike. So that is why we are spending so much time and effort emphasizing flu vaccination, because whilst it may only have an 80% or a 90% efficacy, it is the best option we have for preventing flu. It works, it's proven, and it's safe. And that way, we are looking to that as a further way of reducing demand on hospital beds over the winter, in particular, and allowing us to have more capacity to deal with any potential COVID wave.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
We've seen some businesses have enacted stiffer restrictions than what the public health guidelines are. For example, restaurants have told rotational workers they're not allowed in after their 1 week of isolation and a negative test, saying, nope, if you've been outside the province in the last 2 weeks, we're not going to let you in. Other businesses won't accept people who have someone at their home who's isolating. So this is above and beyond what's being recommended. Should businesses be doing that, or should they be following the letter of the recommendations from public health?
So, I mean, we can't control what a private business will do per se, but the regulations or the recommendations and guidance that we have in place certainly is based on the best science and the best evidence that we have. With regard to rotational workers, we do advise that for those 7 days after they have testing that they can't go to any gatherings, mass gatherings, and avoid crowded spaces and things like that. So I guess there is some precedent for that maybe, but with regard to someone isolating in the home, I guess it's certainly if someone is isolating or self-isolating within a home after coming back from travel, for example, they should be separated from all people in the house, and they shouldn't be spending any time together. They should be in their own space, and the rest of the household should be in their own space. So the risk there would be quite low.
Question about the Santa Claus parade. There is a plan right now in order to have it kind of like a reverse parade where people would drive by the floats instead of the floats driving by them, because obviously crowds of people on the side of the road are an issue. What would the recommendation be in terms of how to do a Santa Claus parade safely in the time of COVID?
Well, certainly we do have some guidance on the website with regard to parades and other outdoor celebrations and ceremonies. So I'd certainly refer people to that. But a drive-by parade, I guess, is one way to do that. Obviously, you would have to make sure that people who are on the floats together and that the floats are spaced so that bubbles aren't mixing and things like that. But anything that will cut down on a crowd gathering, and certainly there would have to be some crowd controls at the beginnings and ends and that sort of thing. So there is some guidance out there, and I'm sure there's lots of creative people out there who are able to figure out how to make that work for them.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. My question is in regard to rotational workers. Wondering about the classification to become deemed a rotational worker for the province of Newfoundland and Labrador if one has property here and routinely comes to the province but doesn't have an MCP card for Newfoundland and Labrador.
The definition of a rotational worker is someone who is a resident of Newfoundland and Labrador. So they would have to qualify, I guess, for the definition of a resident in order to qualify for the definition of a rotational worker.
And I'm just going to refer to yesterday's briefing just briefly here. You had spoken about exemptions for self-isolation yesterday for excruciating circumstances. How does one apply for such an exemption?
Sorry, Kellyanne, I missed exemptions for?
For extenuating circumstances, you had noted yesterday that they would have to be pretty drastic, but that there is a way to apply for such exemptions. Just wondering how one goes about doing that.
For self-isolation exemption, you mean?
Yes, sorry.
Oh, okay. So basically it's an email. Generally, most of them come in through the exemption emails, although we do get some through other means. But often it's someone has applied for a travel exemption, and then the question comes up after. But I need to be able to leave self-isolation for some reason, and so each of those are assessed on their own merit. But most of these people are applying for a travel exemption, right? If not all of them. So generally, it's just a follow-up email to that travel exemption email.
Thank you.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Oh, I thought we went blank again for a second. Can you, Minister Haggie, Dr. Haggie, can you offer more information on the 92% reduction figure you mentioned yesterday? You said that our travel restrictions.
Oh yes, that was in one of
where that came from.
Yeah, that came from Dr. Rahman's team. We have regular COVID updates, and it was a discussion that we had at the time, and that's where that figure came from.
Okay. Are the workings of those public? I'm wondering, for example, whether the ban on non-resident visitors is included in that calculation.
This was travel restrictions in their totality, so it would include anybody really who had to apply for an exemption or was in need of self-isolation. In terms of publication, these are ongoing works in progress, as it were, with regular briefings from the predictive analytics team. We have from time to time got Dr. Rahman's team to compile them into presentations, you may remember, and those are certainly available through our website. There is an intent to maybe have a further update on some modelling, and obviously under those circumstances, that presentation and those data would be put up on the website too.
Okay, thank you.
Our next questions are from Richard Duggan of the OCM News. Please go ahead.
Dr. Haggie, last week you gave an update on the numbers for the flu vaccine clinics. I think it was on like 14,000 appointments within the first couple of days. I was just wondering if we could get an update on those numbers.
Certainly, I had a number given to me yesterday which represented those given by pharmacists, and I think the number is slightly north of 28,000, and the number of appointments booked through public health is of the order of 52,000. I can certainly get you those numbers down to the appropriate digits. I didn't bring them with me. I saw them yesterday or the day before, but that's no problem. So order of magnitude, we've got about 85,000 people accounted for in the first week to 8 days.
Thank you. And my next question is on frontline healthcare worker fatigue. In the early stages of the pandemic especially, we heard of fatigue amongst frontline healthcare workers. With the risk of a second wave continuing to loom, what are health officials doing to try to mitigate those effects on healthcare workers should that second wave hit?
Certainly, the health of healthcare workers is a priority for us, and we will be ensuring, for example, they have ready and easy access to the flu vaccine, and we would look to try and get as near 100% of those vaccinated as possible. It's one element. In terms of over the summer, you may remember, because of the timing of COVID, that once the first wave faded and the weather improved, a lot of collective bargaining units had their leave allocations approved. So over the course of summer, we managed not only to increase the proportion of cases and the backlog that was dealt with over and above what we could have managed otherwise, and yet we've still been able to get leave accommodated too. So we're about back to where we should be as far as I'm understanding from the regional health authorities. The only groups that have been particularly challenged certainly has been public health, and I would give a shout out to them because they are in need of a little bit of rest and rehabilitation in some areas particularly, and we hope to be able to work through that over the next little while. There have been other pressure points as well, and we've tried from a departmental and a regional health authority level to alleviate that where possible. Overall, the information I'm provided with by the regional health authorities is pretty optimistic looking at the moment.
Thank you.
Thank you, Minister. We do have time for another round of questions, so each reporter will be given the opportunity to ask one question and one follow-up. Following this, I will ask if there are any further questions. Next, we have Peter Cowan of CBC News. Please go ahead.
Thanks. A question about Christmas. We're getting a lot of questions about it, and I know that public health is already looking at it. When do you expect to announce what sort of options will be available? Because I know a lot of people, this is the sort of thing that they need to be able to plan in advance to be able to figure out what they're going to do.
Yes, we are actively looking at it, and as I said, we had our Christmas squad together, and so we're in the process of developing options to present. So I hope that we'll have something. I don't think it'll be next week, but hopefully the week after that.
And what sort of impact do you expect the spike in cases in many other areas of Canada to have on the restrictions or the process that you decide to put in place for Christmas?
Yeah, we're certainly considering those very closely. That's factoring in, quite considerably into our discussions. We know that as we see more cases in the rest of Canada, and if more travelers are coming home, that we're likely going to see more cases here. So that is something we have to consider very closely, and it will have an impact on what we ultimately decide to do for sure.
Just as an aside there, you've seen within the last few days the European Union has removed Canada from its list of safe countries as regards COVID, and I think that's a testament to the national scene that we are also looking at closely. And I think those are not good signs.
Thanks.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Minister Haggie, you noted yesterday you had just received the findings from the pilot project when it came to rotational workers and the testing program. I'm wondering if you're encouraged or discouraged by the results of what you've read so far.
We're still in the process of looking through those recommendations, and as I said, I hope to be able to present something to you by the end of the week. So watch this space.
Thank you. And I also have a question regarding Christmas. We've seen across, I guess, North America, really, a lot of holidays canceled elsewhere, Halloween, and a lot of other jurisdictions, but not here. Do you expect to see the gathering sizes change within the province over the coming weeks, or is this something we just have to continue to watch with epidemiology?
Yeah, so I think at this point we have to really be careful. I mean, certainly our recommendation is going to be to keep your number of contacts small and to avoid gatherings if if it's at all possible. We are seeing, as I said yesterday, that many of these outbreaks that we're seeing elsewhere are being fueled by gatherings of groups of people who aren't normally in each other's bubbles and some other settings as well. But certainly the gatherings of groups of people is a concern. And I think when we've talked across the country, and if you look in media reports across the country, all chief medical officers of health are talking about reducing gathering sizes. Social gathering sizes, sorry, not in general. But, so that's something we're going to recommend. With regard to changing the sizes of gatherings at this point, I think, given our epidemiology, we're not in a rush to do that. But as you say, we will be watching things closely, and we won't hesitate to change that if the epidemiology supports it.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Yesterday, the idea of the travel to Cuba came up, and Dr. Fitzgerald said that you don't recommend international travel. Doesn't the province have jurisdiction, in theory, to extend its bubble internationally, not only to Cuba, but St. Pierre, perhaps?
Sorry, Peter, it was a little difficult to hear some of that about jurisdiction at the end. Yeah,
I'm wondering whether the province has the jurisdiction, in theory, to actually extend its bubble, so to speak, to, for example, St. Pierre or Cuba, that kind of thing.
Yes.
Sorry.
I was going to say international travel really is the people who are returning from international travel fall under the Order in Council of the federal government that requires quarantine. So that with regard to expanding a bubble to include that, it's not really. I guess it's not something that we have to mandate. I mean, the Public Health Agency of Canada does not recommend international travel at this point, but people aren't barred from traveling, but we certainly don't recommend international travel at this point. So the self-isolation order that's in place at the federal level would apply to anyone who was returning from any international destination.
Okay, thank you. And a gentleman asked us about dancing. Certainly there are a lot of generations on the island who like to have a scoff, and I realize that that's not recommended under gatherings now. Is there some possibility that those would be considered okay, for example, under double bubble plus 6, that sort of permutation?
So I don't know that I want to get into that level of nitty-gritty on stuff, but what we know about dancing is similar to what we know about a lot of things, and we made that rule with regard to any place with a liquor license, and mainly just because of how close people tend to get and the congestion on the dance floor, and up and about, and you know, if you're being more physically active and breathing heavier and that sort of thing. So, you know, what people do within their bubbles, I think you have to use your common sense, and you have to look at what's safe and what isn't. So, I guess I have to defer to people's best judgment in that situation.
Okay, thank you.
Our next questions are from Richard Duggan of VOCM News. Please go ahead.
Thank you. Back on the topic of flu shots, I got an email from my son's school the other day saying that they're preparing the process of bringing in the flu shots into that school, and that they would only be administered to kids in grade 4 to 12. Now, correct me if I'm wrong, but all of what I've read on the flu shot has indicated that anyone over the age of like 6 months, I think, is advised to get it. So I'm just curious, why aren't the younger grade levels being included in the administration of these flu shots?
So we are recommending it for everybody over the age of 6 months. It really just has to do with, you know, how well you're going to be able to do that. Right now with school, we have recommended that, you know, the only people who should be going into schools are people who are important to the curriculum for students. So obviously children in grades K to 3, it's a little bit more difficult, and I can speak from mounds of experience as a family doctor. It is a little bit more difficult to give an injection to those children, and because they tend to get upset and they need to be held and that sort of thing. So, you know, it would be, I think, very difficult for one nurse to be able to do that without having the parents come in. And so we didn't feel it was appropriate for all the parents to be going into the school on a day that they were doing flu shots. So, you know, our recommendation is that children a little bit older would be able to understand the importance of it and be able to cooperate with getting a flu shot. So that's why we made the recommendations from grades 4 to 12 to get it in school. But obviously anyone in grades K to 3, we are recommending the flu shot, and you know, parents can certainly either go through their family doctors, through their pharmacist, or through one of the public health flu shot clinics to get that.
Thank you. And still on that topic, where are we with rolling out the flu shots in long-term care homes?
Flu shots in long-term care homes have been ongoing, is my understanding. And those flu shots are given over the course of a few weeks, generally, by the staff of the facilities.
Thank you.
Peter Cowan, do you have any further questions?
One follow-up question on flu shots for the minister. What's your take on, you were mentioning we're now at about 80,000 people that have at least signed up for a vaccination, considering our normal level was only about 30% in an average year, and that's about 20% of them already. What do you think that says about the uptake of the flu vaccine this year?
It's difficult to predict the future. We've seen in the past that the first week, and indeed sometimes the first night or two, has been a period of great demand. I can recall, I think it was last year or the year before, where the fire inspector closed us down one night at the Jack Byrne Arena because we had too many people in the building. Obviously, that is something we want to avoid in the COVID situation. Cautiously optimistic, but not, again, any grounds for complacency. So we will keep on giving out the message, making the plug, timefortheshot.ca. For those people who have challenges with the internet for various reasons, there is a toll-free number, and the operator there will enter your information into that database, into that program on your behalf. So this is key. We need to keep the population as healthy as possible. With an older group, the double whammy of flu and then COVID, or the two simultaneously, would be a real challenge medically for them. And I think it would be a significant challenge for the healthcare system should we have a serious spike in both at around the same time. So cautiously optimistic, but not sitting on my hands being complacent.
Okay, thank you very much.
Kellyanne Roberts, do you have any further questions?
I also have a flu shot follow-up. I'm just wondering, with seeing the demand so far, has there been any issues in supplying the flu vaccine to pharmacies or any of these flu clinics?
No, we did have a little bit of an issue last week where there was some confusion about the RHA's releasing vaccine on demand rather than to some predetermined schedule. That's been fixed as far as I'm aware, and I haven't heard of any problems subsequent to that. We acquire our vaccine in 2 tranches. We've got over 200,000 vaccine doses already, and the rest usually arrive around the Christmas period. So at the moment, we're on track.
Thank you.
Peter Jackson, do you have any further questions?
I just have one quick one, and also I'd like to thank you for coming back to answer the question. And that is, can you, Dr. Fitzgerald, explain the difference between pre-symptomatic and asymptomatic? Is one just a subcategory of the other?
Not really. So pre-symptomatic is somebody who will go on to develop symptoms, but we find them in that time period before they develop the symptoms. That could be any length of time before they actually develop symptoms, whereas an asymptomatic person is somebody who doesn't ever develop symptoms. So they may have a positive test, but they never become symptomatic as a result of having been infected with the virus. And, that happens with a lot of viruses, so it's not unusual. And but there's always that period of time where you may be infectious, but just not symptomatic, and that's what we call that pre-symptomatic period.
Thank you.
And Richard Duggan, do you have any further questions?
I'm good, thank you.
Thank you very much. Have a great evening, everyone.
Thank you.
Thank you.